In the next 10 minutes, I'm going to answer the 5 most common questions people have about hip replacement surgery. This is probably one of the most common questions I get asked as a PT. So after hip surgery, patients want to know when can they start driving again. Typically, 1 month is the average time patients get cleared to start driving. This is assuming that they had surgery on their right hip. So if you had surgery on the left hip, typically it's actually half the time. So I've seen patients who've had left hip replacement surgery and be functional enough and pain-free enough to that they can start driving 2 to maybe 3 weeks after having the hip replacement surgery on their left hip. Now, if it is on the right side, you do have to have certain clearance in terms of pain-free range of motion and then a decent amount of strength with your hip flexor. So being able to lift up your leg. Typically, we want to see if you're able to do that straight leg raise, that movement where you're lying on your back and able to lift up your leg, just so you have enough hip strength to move your foot from the gas pedal to the brakes. Now, with that being said, you do want to be cleared by your surgeon, your orthopedic surgeon, and or your PT, because you have to have those criteria met before you get behind the wheel. The next question is, when can I start walking again after the surgery? This is actually one thing that a lot of people don't know going into a hip replacement surgery, is that the day of the procedure, you're going to be up on your feet and you're going to be walking. So a lot of people will think that, oh, after that surgery, it's going to be very painful and I'm going to be in a wheelchair or I'm going to need a lot of help and assistance just to stand. But actually, even though initially you're going to need a little bit of help just to get onto your feet, you're going to be able and capable of walking with a walker that day of surgery. And then from there, once you discharge back to your home, you're going to be increasing your walking distance, your walking time, gradually, pretty much like every day or every other day throughout your home, right? So you're not walking far distances, but in terms of when you start walking, it's going to be the day of surgery. Now, how much pain should you expect to have after the procedure? So generally, one of the trends that I often see with the hip replacement surgery is that first 1 to 2 days post-op, pain levels are on the lower side. So maybe like a 1 to a 3 out of 10. So this is because because you went under general anesthesia from the procedure, some of those effects are still lasting and are yet to leave your system. So first 1 to 2 days, typically on the lower side in terms of your pain. Now, that first week is usually going to be the most uncomfortable in terms of your pain symptoms, right? So you can be around like a 4 to 6 out of 10 with your pain for your hip. Now, with this type of pain, it's not going to be similar to the hip pain that you had prior to the procedure. It's not going to be that arthritic type of pain. It's going to be more of that post-op, just healing tissue type of pain. Now, with that being said, it actually improves rather quickly. So after 7 to 10 days, the pain starts to decrease. And especially as you manage your symptoms with maintaining proper positioning, so you're avoiding the movements that aggravate or irritate some of your symptoms of your hip, and you're consistently working on the icing at the hip as well as maybe closer to the knee and above. Those are going to help manage a lot of that pain and swelling. So generally, pain is going to be better than what it was prior to the surgery, and especially as you get into that 2-week mark, the pain continues to decrease to where some people, I've had a lot of patients where they said, oh yeah, I mean, it's like 2 out of 10 and continues to decrease from that after 2 weeks. But usually that first week, you're going to have, pretty moderate healing type of pain. What should I avoid after the procedure? Now, this question is going to be answered a little bit differently depending on the type of approach that your surgeon used for your hip replacement. So what I mean by that is, when I say the approach for the hip replacement, there are different places in your hip that they'll go through. They can go through the front, which would be the anterior approach, or the back, which would be a posterior approach. And there's also other variations, so they'll do like a posterior lateral, anterior lateral. So different parts of your hip can be entrance or entry points of where they do the incision and where they do the replacement. And then obviously they have different partial or full joint arthroplasty or joint replacement. But so we're going to keep it very simple. Typically, when you get sent home what your surgeon is going to do is they'll tell you, okay, you had this type of approach, you need to avoid these specific movements, right? So I actually have another video specifically talking about the anterior approach, which is the most common approach that they'll use for hip replacement surgery. So if you had that replacement done where your incision is on the front side, that's the most common type, and then it'll be the posterior approach after that. So in general, you want to avoid the extreme movements of your hip. So for example, the anterior approach, you want to avoid having your leg behind you, especially with your foot pointed out to the side. Now, if you want to learn a little bit more about what specifically you want to avoid, you can check out another video that I have that explains this in more detail. How long do I need to use an assistive device for? So this question is going to depend on whether or not you needed one prior to the surgery. So let's say if you did need one, whether that be a walker or a cane, typically you'll need some kind of assistive device 2 months after the surgery, right? And then usually you'll be done with the assistive device. By that point, is just because you were relying on that before the surgery, we're going to have to work on building the strength, the stability, and the balance back up to where you're not walking with faulty gait mechanics and you're not compensating with your walking because you were altering how you moved when you're standing and walking by using and depending on an assistive device, right? Now, let's say you didn't need one prior to the surgery, you had good strength, good balance, and stability. Typically, that walker, you'll usually only need it for week 1 to week 3, and then you're transitioning to the cane. The fastest I've seen someone transition from a walker to cane is actually about 2 days post-op. So at that point, they were able to stand on the surgical side with minimal to no pain, so maybe like a 1 out of 10 to no pain. They were able to have good hip and quad strength, so they can do that straight leg raise, as well as when they were practicing their walking with the walker, they didn't have any limping, so they weren't, having that antalgic gait is what we call it, but essentially they weren't having that limping pattern as they stepped with their surgical side, right? So that's typically like the 3 criteria that we're looking at to transition from a walker to a cane. Now, in terms of when you have that cane, that you're going to be usually using that for about 2 weeks once you first transition from the walker to the cane. Usually you're on the cane for about 2 weeks. You don't want to be on it too long, but primarily at that point, that cane is just to help you improve your coordination and your the actual gait mechanics, so how you're walking, to make it more fluid and more normal-like. So making sure that you're not compensating when you're walking, you're not limping, right? You're not doing any shuffling patterns, so it's not like flat-footed type of stepping or walking, and you're trying to focus on more like heel to toe type of mechanics when you're using the cane, because if you're trying to use the cane for stability, that's not what it's really meant for. It provides you a little bit of stability, but it's not meant to be really weight bearing where you're leaning on it. It's just to help support your normal gait mechanics and give you a little bit more like assistance with your balance. But ideally, you're not using that cane for too much longer than 2 weeks. It's just to get you back to normal controlled movements with your walking. Thanks for watching. If you found that video helpful, please subscribe to the channel, and I'll see you in the next video.